This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised. In this podcast, I speak to Michael Salter, the director of ChildLight East Asia and Pacific Hub at the University of New South Wales. His research focuses on child sexual abuse, primary prevention, gender-based violence, and complex forms of victimization, including organized abuse and technologically facilitated abuse.
When we look at reviews of workplaces that have facilitated the sexual abuse of children, a sexualized workplace culture is a risk factor because people have been allowed to breach their boundaries and breach appropriate professional boundaries routinely in their workplace. And that tends to camouflage other kinds of offending, including offending against children.
This is the #NoExcuse podcast, discussing the challenges and complexities and potential solutions in preventing and responding to sexual exploitation, abuse, and harassment in the aid sector, through interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and global focal point for the department. So this episode is going to be speaking about child sexual abuse, which is a very tricky and difficult conversation to have, but I think a very important one to have. So welcome, Michael Salter.
Thanks so much, Guni, and thank you for the opportunity to speak with you today.
Michael, before we deep dive into our conversation, I'm curious to know, what drew you to focus your career on child sexual abuse?
I actually started my career 25 years ago working in public health and public policy, particularly in the primary prevention of bloodborne viruses. The Australian response to HIV and hepatitis C prevention is one of the best in the world. At the same time, a very good friend of mine who I met as a teenager was really struggling with the aftermath of child sexual abuse. She'd been severely abused here in Australia. And there was nothing for her. There was no services. Police were really hopeless. Sorry to say, they were hopeless. Mental health services weren't helpful. Crisis services weren't there for her. And, my public health training really sent me to look at the data. There was no data. There was no research. And so I made a decision at a certain point to leave that area of work. I didn't feel like they needed someone else. There was a lot of good people working in HIV prevention, and I changed my career. I went back to school and I did a PhD in the study of child sexual exploitation. And about 15 years ago, I published the first book in Australia on the sexual exploitation of Australian children. And really, it's just been that gap and that silence that we see around child sexual abuse that keeps me motivated.
What do you think we need to understand for the public about child sexual abuse that is maybe more common to the general public, and then we can kind of link it back to the aid sector?
When we talk about sexual assault, sexual violence, we tend to think about an adult victim. Actually, for many or most victims of sexual assault, the onset of sexual violence is in childhood. I was speaking today with colleagues in Thailand. For 80% of sex offenders in prison, they're in prison on a child offence. So really, I think we need to invert our approach. When we think about sexual assault, we should be thinking about a child. Children are the primary victims of sexual violence. That's not in any way to negate the impact of sexual violence across the lifespan. But for most victims, it's starting in childhood and then will often recur in adulthood. That also means we need to pay attention to how frequent perpetration is. We shouldn't normalise perpetration. But in the research that I've done, and I've done large-scale surveys here in Australia, in the UK, and also in the United States, in Australia and in the UK, 10% of men acknowledge committing a sexual offence against a child, whether that's online or offline. And in fact, it's higher in the United States. It's about 14% of men. What we find is that about 1 in 6 men acknowledge some sexual interest in people under the age of 18. So the numbers are there not only in terms of victimisation, but the numbers are there in terms of perpetration. And a difficult piece to this, but it's a really important one to understand when we talk about safeguarding, is in the data that I've gathered, it's very clear that men who abuse children are disproportionately likely to seek a professional role that puts them in touch with children. And so on one hand, it's a really honourable profession to work in safeguarding, to work with vulnerable people. It's a really honourable way to commit yourself to the public good. At the same time, we shouldn't be naive. These roles, these professions, these contexts, particularly that provide access to vulnerable children, are disproportionately likely to attract offenders. And we need to think about that very carefully.
And in the aid sector, where we've heard high-profile cases of abuse, from your perspective, what makes the humanitarian and development setting particularly vulnerable to child sexual exploitation and abuse?
I think the word that you just used is an important one, which is vulnerability. So what we have is a combination of vulnerability on one hand. So you may have workers in a development context where there may be no child protection system. There may be challenges around law enforcement for offences against children. There may not be adequate legislative frameworks around offences against children. You may have large numbers of kids who are vulnerable in all sorts of ways, whether that's poverty, whether that is their kids in the context of migration or conflict. So you've got vulnerability on one hand, and the other important issue is accountability for the workers. So these are often individuals or organisations. They are out of country. They are away from the normal structures that hold them accountable. They're in an environment where they may have a lot of discretion. And you mentioned earlier a lot of power differentials in all sorts of ways in relation to the citizenry and the local population. What we know for sexual offending more broadly, but particularly child sexual abuse, is this combination of vulnerability on one hand and a lack of accountability on the other is absolutely toxic. And wherever those two things intersect, we would expect to see increased risk of sexual offending against children.
Why is it important for us to speak about child sexual abuse and exploitation committed by aid workers?
Work around development work, aid work is inherently work that involves vulnerable people and involves power inequalities. And that's where we should be paying proactive attention, not reacting to a scandal. It's too late then. And not only have we had children harmed, but fundamentally the legitimacy of the organisation is fundamentally damaged. And it should be damaged. I'm sorry, but if we are not capable of proactively protecting the children that are in our care, we shouldn't be trusted. We're not trustworthy. So proactive safeguarding and brave conversations. It's difficult. I've had to go into schools and say, my data says that men who abuse children are more likely to work with children. Now, that's a very awkward thing to say in front of a group of teachers when 20 or 30% of those teachers are male. But the truth is that my job is not to keep adults feeling comfortable. It's to keep children feeling safe. And so we do need to have awkward and uncomfortable conversations, and we need to be brave about that. And we need to be clear that we've got nothing to hide. And if there is a challenge to us that says, well, if these stats are true, what are you doing about it? We should know what our answer is. We should have a very, very clearly articulated policy that says we have zero tolerance and it's evident through all of our actions.
And so if we move into prevention, and I know that you do use a model that is linked to a public health, model, and it is also something that as an organization, being, the WHO, we've looked into that too. Could you tell us a bit more how we can approach this in a primary, secondary and tertiary prevention?
So when we talk about primary prevention, we're talking about activities, interventions that reduces the prevalence of child sexual abuse. It tells us that we can take action to prevent child sexual abuse before it occurs. Primary prevention can take a number of different forms. We can think about structural forms of prevention. So when I say structural, I mean public policy. In development context, that means supporting jurisdictions to build child protection services, to build law enforcement capability. If we look online, for example, one of the issues that we have with the internet is that it has no child protection safeguards built in. Technology companies have not been obliged by law to prevent child sexual abuse before it occurs. And it's one of the reasons why we have such high rates of sexual offending against children online. In fact, my data shows it's the primary site for child sexual abuse. More child sexual abuse takes place online than takes place offline. And so we can also do primary prevention at the organisation and institutional level. So we can think about our policies, our procedures. We can think about the culture of our workplace and the sorts of behaviour that's accepted or normalised, even informally, and the sorts of behaviour that's clearly held to be unacceptable. That question at institutional level, if you think about a development context, accountability is really, really critical there. So accountability in terms of the local population, in terms of co-design, collaboration, democratic decision-making, transparency is really important to the prevention of child sexual abuse. Child sexual abuse happens in secret. It thrives in secrecy. So how do we do that work in a development context to make sure that our actions, our behaviours are accountable to the citizenry of that country, and we're clearly transparent and accountable for our behaviour?
We have the primary prevention, which is really structural, making sure from recruitments, from making sure that we have policies and structures that prevent a culture that prevents this. And then secondary.
So secondary prevention is looking at circumstances of risk. So it's looking at circumstances where we see risk elevated. Secondary prevention, when it comes to child protection, we're often thinking about kids who are at elevated risk of being exploited or abused. So we need to think about the sorts of children in a development context that workers have access to that we can consider situationally. How do we build safeguards into that situation or that institution or that context? It can be very practical. Making sure that nobody is alone, no one adult is alone with one child, for example, that there's always two people there, that there's always a door open, and that there's measures in place to make sure that kids are supported to know that if anything happens that they're uncomfortable with, there's somewhere for them to go and there's somewhere for them to speak. So that situational contextual safeguarding is really important.
So in the aid sector, or in the way we would go about programs, is like making sure that within programs or within our operations, we've embedded these safeguarding measures that are beyond just a policy, but it's those practical things that people will be able to pick up on. And then finally, the tertiary one.
So tertiary prevention refers to the things that we do after the harm has taken place to reduce the harm and also reduce the risk of recurrence. It is important to understand that childhood trauma, including child sexual abuse, has a number of ripple effects. One of the things that it does, particularly for traumatised boys, is it increases the risk of future perpetration, not only of child sexual abuse, but of a range of negative behavioural outcomes. So if boys have been abused, really important that we get in and support them. They deserve that anyway. But from a prevention point of view, we're also stabilising that boy. We're restoring his behavioural health and making sure that he can go on to have healthy relationships. Now, that's true also with girls, but they're also at high risk of being abused again, of experiencing domestic violence and being subject to sexual assault in adulthood. For a similar reason, the other piece of a tertiary prevention intervention is actually investigation and prosecution. So where people have done the wrong thing, where they've committed an offence, they need to be detected and they need to be held accountable. That does a couple of things. Firstly, it prevents them from going on to reoffending, not least of which if they're put in prison, then they can't offend while they're in prison. So that keeps kids safe for that period of time. But it also sends a message back to the offender community and it says, if you hurt children, you will be held accountable. Our challenge is that often that's where a lot of the money goes. It's where taxpayer money goes. It's where philanthropic and funding money goes. It goes to the tertiary. And so one of the things that we're trying to do when we talk about prevention is really encourage governments and funders to move upstream to think about what are the intervention points before it gets to a sexual offence against a child.
Do you have any data on how effective it has been so far about all these investment towards tertiary prevention?
So we've got very good data in high-income countries. It's clear that over the last 30 or 40 years, as high-income countries have become more aware of child sexual abuse, as the social norms have changed, so a clear articulation that child sexual abuse is wrong and harmful, as we've built child protection capacity and we've also scaled up prosecution of child sexual abuse, it is very, very clear that rates of adult offending against children have gone down significantly. Now, they're still quite high. I'm not pretending for a moment that a country like Australia does not have a serious problem with child sexual abuse. We do, but it's been going down. Now, at the same time, we've seen other forms of sexual violence against children increase. So in my country, we've seen a doubling of rates of sexual abuse by children against other children. It's primarily teenage boys committing offences against their female peers. If we also look at online offending against children, there really was no such thing 30 years ago, and now it is the most common form of offending against children. So while we've seen success in some areas of child sexual abuse, we've seen the emergence of new forms, we've seen increases in other rates. And again, the message here is very much for governments and for authorities, it's around regulation. One of the reasons why sexual offending by boys against girls in my country has increased over the last 20 years quite rapidly is actually early exposure to pornography, for example. So because we didn't do the work to put age verification protections around adult content, we have 12 and 13-year-old boys exposed to pornography and then behaving inappropriately and coercively against predominantly female peers, but sometimes it's their sisters, sometimes it's much younger children. So there's lessons there as well from a prevention point of view.
So if I understand this correctly, we are looking at that there's a greater impact in the primary prevention because we're tackling more on the culture around this, right? Like, and making sure that the structures and governments are putting in place safeguarding measures or defining what's acceptable and what's not acceptable. I'd like to make a parallel between, you were mentioning online sexual, abuse, and I'd want to make a parallel with digital workplace sexual misconduct. So meaning, in other words, is when we have this new form of sexual misconduct that could be sexual harassment, email sent, pornography, like sent to a colleague. With the rise of online abuse, what are some of the parallels we can understand and maybe potentially draw important information to organizations of how to safeguard that side of digital workplace sexual misconduct?
So that question of a sexualized workplace is a really important one. People downplay the impact of sexual harassment. People assume that a comment or a gesture or a pattern of sexualized behavior seems relatively trivial. Here in Australia, I completed the largest national sexual violence survey of LGBT people. Now, if we put aside the question of the fact that they were all LGBT for a moment, we asked about 5 or 6 questions about different types of sexual violence. It included sexual harassment and it included sexual assault, other sorts of abuse as well. We asked them what the most impactful form of sexual violence was, because most people who'd experienced sexual violence had experienced multiple forms, which is typical. And sexual harassment was really high for people who were talking about the most impactful incident. Sexual harassment destabilizes people at work. There's a loss of confidence. There's a fear. It's a threat to your income. And we can also think about the impact of sexual harassment on somebody who is a survivor of child sexual abuse and what that means to them, that their workplace is no longer a safe environment. The other point that I'll make is that when we look at reviews of workplaces that have facilitated the sexual abuse of children, a sexualized workplace culture is a risk factor because people have been allowed to breach their boundaries and breach appropriate professional boundaries routinely in their workplace. And that tends to camouflage other kinds of offending, including offending against children.
And what would you say practically or technically even, what are some of the things that organizations can do to prevent this?
So the critical factor is always leadership. So there is a big leadership question here about people at very senior levels of the organisation setting kind of the cultural standard and then embedding standards for best practice. Now, there are many models here around gender equality in the workplace. And if we see that lack of accountability and that lack of concern at a senior level, then of course more junior staff will feel that they have some impunity and some license to act however they might feel like. So I think leadership is really critical here. And I would say that that's also critical for child sexual abuse prevention, that a more gender balanced workplace, particularly at a management level, is a workplace that's safer for children.
So I just wanted to touch base on the point of some of the data, as you mentioned, are very male dominant, meaning male perpetrators. Is the assumption that child sexual abuse is mostly perpetrated by men?
So men commit the majority of violent offences. That's true around the world, and it's true of child sexual abuse. We focus our study on male offenders because, to be honest, we know the most about men who commit child sexual abuse. Most of the research is done on men, and we felt confident in our ability to craft a survey for the general community that was asking targeted questions to understand the proportion of men in the community who are offenders and who are interested in children. Women make up an important proportion of child sex abusers. They tend to be in a facilitating role. They tend to be facilitating men's access to children, though not always. Women are relatively rarely sexually motivated to abuse children, although they are sometimes. But particularly when it comes to sexual exploitation for money, that's where we see a preponderance of female perpetrators. And I would say that's also true in my country when I do research with children who have been abused particularly for financial purposes. It's pretty common that they're identifying a female offender.
And I'm also thinking in the public health sector when sometimes carers are nurses or female doctors for thinking, polio campaigns, for example, where we go into, people's home for vaccines. And so I think that gives an even bigger layer to understanding this issue and even reporting these types of child sexual abuse.
That's right. And if we look at vulnerable children who are sick, children who are unwell, children who are institutionalized or dependent on institutional care, children who are dependent on caregivers more so than kids are, and kids are very dependent on their caregivers, but where children might be living with a disability or a chronic illness, we see much higher rates of child sexual abuse amongst those children. And so that goes back to some of those discussions earlier about secondary prevention. How do we build accountability, transparency? How do we support those kids around their inherent vulnerability? Because those are children that are particularly at risk. And unfortunately, those are also environments that are much more likely to attract offenders.
Mm. It is a very uncomfortable conversation to have, and it's stats and numbers that are quite horrific. And you're just thinking, wow, how do we make sense out of this? How do we, then take action and not just stay stuck at, oh my God, this is horrible, right? So I do think that that's the next step for us to learn and shape the way we go about our work in a more responsible and accountable way. So thanks, Michael. Last question before we part ways is, what keeps you going? Because it is a very heavy subject. What keeps you going on making sure that this information is out there and people are aware and take actions towards it?
Look, I love working with survivors. I love hearing from survivors. I love the relief that survivors feel when these discussions are had openly and without any shame or stigma. It's really the people that I meet, and I wouldn't have it any other way. But I love the work, and a lot's changed in the 25 years I've been doing this. And, I've got maybe another 25 years to go, and I look forward to seeing how much better it is in 20 years.
Fantastic. Thanks, Michael.
Absolute pleasure. Thank you for having me.
Thank you for listening. If you have any feedback or questions, feel free to reach out to us to prseah@who.int. Until the next time, goodbye.